We have a great episode today. I'm looking forward, I'm sure you are too, Tom, to conversations with three nonprofit hospice leaders, Tim Meadows from California, Karen Rubel from Nevada, and Viki Jingle from Texas.
Oh, it's going to be a great discussion. Really excited about it. And we're really going to have, I think, a good dialogue around the current hospice narrative, quality leadership, and telling a more complete story about hospice care.
Yeah, I think the moratorium really set off a lot of conversations that aren't totally helpful.
Well, I think, it's a very controversial situation that we're in. Certainly the fraud and abuse issues are clearly critically important to address. And how we do it, I think, is what's been so interesting to discuss.
Yeah.
Later in the episode, the team from Luna and Isenla will join us to talk about ways to connect with the local media.
Which will really be helpful for our members.
Yeah, absolutely. Looking forward to it.
Yeah, it'll be great. Really appreciate you all joining us and thought we'd start with some quick introductions. Maybe tell us who you are, your role in your community, and where you're joining us from. So Tim, why don't you kick it off?
Hi, I'm Tim Meadows. I'm the Chief Executive Officer for Snowline Health, and I'm talking to you from the foothills of the El Dorado of the Sierra Mountains out here near Sacramento.
Which is a beautiful part of the country. So thank you, Tim, for joining us. And Karen?
Hi, I'm Karen Rubel. I'm the Executive Director for Nathan Adelson Hospice and also the President of Chapters Health West. And I am located in Las Vegas, Nevada.
My favorite hometown for myself.
Indeed.
Good to be with you, Karen. And Viki.
I am Viki Jingle. I am the CEO of Community Healthcare of Texas. And we are located in Fort Worth, Texas, but we service the entire DFW and Waco territory.
Another great part of the country.
Absolutely. Well, we're really delighted to have you all with us today. It's such an important topic, isn't it, Carole? I mean, this has really taken all of the focus recently for hospice.
Yeah, and I can't think of a better group of people to join us than the three of you. So thank you.
Yeah, absolutely. So we thought we'd start with kind of what you're seeing on the ground. Tim, let's start with you and talk about what you're seeing in California. Of course, California, as you know, has been at the center of many of the hospice fraud conversations. What's the reality you're seeing on the ground right now?
Well, sadly in California, there is an abundance of hospices that aren't really hospices. They exist to bill, and they have been defrauding Medicare. And the federal government recently took a lot of action against those bad actors. So, yay, it's about time. It's far overdue.
Yes.
But sadly, the press has led the public to think that the entire hospice industry is fraudulent.
Yeah.
And that's really why I'm glad we're having this conversation. Because while the stories about fraud are serious and they must be addressed, they're not the whole story. And most of us, quite frankly, are ethical hospices that provide comfort, dignity, and symptom relief, and family support every single day and night. And that's the story that people really need to hear more often.
Yes, absolutely.
Karen, I know it's been really confusing in Southern Nevada, too. So tell us, what are you hearing from patients and families, referral partners, community at large? What's going on in your community?
Well, just like California, Nevada became kind of the hotbed of fraud and abuse, and lots of hospices opening up just in Clark County, not even in the entire state, but just in our county of 2.5 million people. So we heard a couple weeks ago that the state of Nevada decided to put a moratorium for 6 months following the lead of CMS. And I think that was well received, though. Like Tim said, some people are making it a little more political in nature, that people are being denied access to care, which is not true. But we have such a problem here that I think it was a good first step in addressing the overall issues so that the state as well as CMS can really get their arms wrapped around what the problem really is here.
Right. Viki, what about Texas? What feels different today there than it did even a year ago?
Yeah, I wish I could say a whole lot has changed, but unfortunately it hasn't. Obviously, we have kind of the same problem that Tim and Karen have as far as a vast amount of new organizations that have come into our arena. They're all staying very small. They're kind of all under the radar as far as having to report any kind of quality or anything. And unfortunately, they're all out there telling our consumers a lot of myths about what hospice is or should be. It's confusing for the consumer, it's confusing for our families, and it's very confusing for our referral sources, because obviously they want to give whoever is going to provide the best service to their families and their patients. And they really are not aware or not well educated on what that is. So I wish we were seeing more. We're the same place that Karen is. The national moratorium went into effect, and our state came out and said, if we can't get any Medicare licenses, we're not going to issue any Medicaid licenses either. So that's good. That's shut the door. But unfortunately, we still have, a vast amount of bad actors that are out there.
It's really unfortunate, isn't it? It's so confusing, particularly to patients and families.
Yeah. And then the moratorium has been helpful in many respects, right? But at the same time, what's happening, what we're hearing from our members is folks are feeling like they're playing the defense, if you will. They're having to always talk about fraud and abuse and kind of, those stories instead of talking about what really matters. So I'd open it up to all of you to talk with our members about how you are managing through this and how are you effectively telling a story that is more important and the most important.
Carole, for us in Las Vegas, one of the things that we did early on to kind of prevent the negative side of talking about fraud and abuse all the time, because it was like my, second full-time job was trying to, make the state aware and the community aware of what's going on. We created a website called choosinghospice.org. And so we really try to direct the community to that website. It has no affiliation with Nathan Adelson. It really is just a resource for families and for patients who are thinking about choosing hospice, and even referral sources on how to choose the best hospice. So there's lists of questions, there's some videos. How do you know that you're on hospice? What kind of good questions should you ask about the local hospice? So we got out in front of it early with a resource that we can go to instead of, always talking about the problem and, what the problem is, giving people resources so that they can go somewhere and get some good information.
I love that, Karen. I didn't realize that you guys had done that. So I will be referring our referral sources and patients there as well. So I think that's fantastic. One of the things that we continue to talk about with our referral sources, especially, but families when we can get in front of them as well, is just to remind them that hospice has been around for over 40 years, that this is not something new. We've been providing care to our communities and our families for over 40 years. So I think when they hear that, it's not something new. It's not something that's fearful. We've been doing this for a long time. And so we continue to remind them that we've been in your community now for 40 years through our, affiliates and whatnot. We've been here serving. This is not a new healthcare stream. It is a new problem because obviously people have figured out how to abuse the situation. So we've been addressing it from that standpoint.
Yeah, great actions by both of you, Karen and Viki. I wrote an article recently and did list some steps for the public to keep in mind when they're thinking about when it's time for hospice, because really this is a trust issue, isn't it? And I'll just very quickly outline the 5 things that I suggested that the public consider when it's that time. And number 1 is review Medicare compare ratings. Go to medicare.gov, hospice compare. There's public data where you, the public, can check into these hospices and see how well we're doing or not. Number 2, determine how long a hospice has served the community. Viki just mentioned the industry has been around for a long time, and we have. So beware of some of the newer startups that don't have a robust data set. Number 3, learn about accreditation and quality standards. NPHI members at large, we go the extra mile to make sure that we're meeting the Medicare standards, and we're very proud of that. Number 4, confirm the availability of evening and weekend support.
Yeah.
Hospices that aren't really hospices don't provide 24/7 support like real hospices do. And lastly, look for providers with a strong local reputation. We do a lot to support our communities, and if you can't find any history or data about a hospice, those are really red flags, so beware.
That's really one of the most important, I think, aspects of the NPHI members as well. As you said, Tim, all of them have been in their communities for very long periods of time, years, and have played an important role in their communities. And I think that, is a real difference, a distinction that's so important.
And it really establishes trust, as you mentioned. It's so important.
It does.
Yeah.
The other thing that really I think is so important to talk about is quality. You touched on that for just a moment as well. One thing that often gets lost in the discussions is really about quality. And we are so proud that most of our members at NPHI, all of them actually, perform above the national average on family satisfaction and quality matters. How do we more effectively elevate that message in our communities?
Agreed. And I think we need to make quality more visible, more understandable, and more relevant for families making these hard decisions. And quality is not just an internal metric, it's back to the trust issue. And programs like CMS's CAPS hospice survey matter because they give families a window into how patients and caregivers actually experience our care. We also need to explain why some agencies are listed as NA, because legitimately sometimes the sample is too small to report. But when an agency opts out of public reporting, like many do in California, they are choosing to not be transparent, and this should cause families pause and ask why. If an organization is committed to quality, accountability, and transparency, it should be willing to stand behind its results publicly.
Yes, absolutely.
Yeah, it's really an excellent point, Tim. And so you're doing a lot to communicate that to the public at large?
Absolutely, yes.
I think that, what I found in talking to people about the quality scores were that people just don't know how to interpret those.
Yeah.
Right? So what does that really mean? And I think for NPHI and for its members, creating some kind of tool or getting out in front of that, and what do those scores really mean? Why do we pay so much attention to those? Why are those so important to us? And just what does it mean to you as a hospice patient, and what does that mean to you as a family?
What's an example of a score that you've had to translate for the community?
Well, I think it's the reporting, right? So when a hospice comes up as NA,
Yeah.
why are they not reporting those scores? And
Yes.
what do those scores mean, right? And why don't they have to report those scores? I think people are surprised that the larger programs are required to report quality data, undergo scrutiny and regulation and chart reviews and those, and then the smaller ones don't.
Yeah.
And so why
is that?
Why does that happen?
One of the things that we've focused on is making sure that our staff are also aware of all of this. I mean, it kind of goes without saying, but there are our own little internal marketers that are out there talking to families, talking to referral sources. And so making sure that they understand about the quality and how to talk about it, how to talk to it, and explain to families and just general consumers that see them in the grocery store with their, scrubs on and say, hey, what do you do? Or tell me a little bit about this, that they can help interpret how important these quality scores are. And one of the things that we keep going back to with referral sources is if somebody is so small that they don't have to report, that should be somewhat of a red flag. It doesn't always mean that they're a bad hospice. They're new, but if they're small, they're staying small. Sometimes it's for a reason that they're staying that small. And or to Tim's point, we have so many. I think the last time we looked, it was over 50% of the hospices in Texas decide not to report their quality data. And to me, that's a huge red flag. So if they're not reporting, you need to just exclude them off of your need to look at roster of all the various hospices that are out there.
Yeah, that's really significant. Hey, Viki, can you go back to your employees? How are you getting that message out to employees? Share with our members some of the techniques and tactics you're using would be really helpful.
Sure. So what we've done is we've started little community we call them community cliques, basically, in each of our locations. We have teams that are coming together to talk about the quality scores. And then those teams are responsible to go out and educate their co-workers about these different various scores. I mean, obviously part of that is so that we're making them aware of how to increase the scores. We want to have higher quality scores, but it's also to make them aware of what is involved in, I mean, what are some of the questions even that are rolled up into these various different questions. And that's been really helpful. It makes them aware of what they're doing and how they're doing it when they're out with families. So just even simple wording, something about I'm educating you on how to take care of your loved one instead of I'm training you on how to take care of your loved one. Just simple things along those lines make a difference when the family's then reporting back and saying, yes, I was educated on that. Because if they're trained on it, they are going to answer the question, I was trained on that. So I think making our staff really aware of what's involved in that, but also helping them. So when a nurse in the hospital stops them and asks them why they should choose their hospice, they can speak directly to it. We have a 4-star rating. Here's, our families choose us more than the other families in this territory. Just some simple words to say. We always, talk about our elevator speech. Well, this is our quality score speech, right? We should be able to answer those questions pretty quickly.
Absolutely. And I think you used a critically important word, which is simple. I think the message has to be easy to understand and conveyed in a way that people get it quickly and understand it without having to sort of overthink it. Tim, you talked earlier a little bit about, and I want to expand on it, we believe that storytelling is a really important part of all of this. And I know you recently authored an op-ed in California's Mountain Democrat. Talk a little bit about the process that you went through to do that and a little bit more about that, because I think it's such a good example of things that others can do in their communities to get the word out in a storytelling way, in a simple way.
The article was inspired by stories I was hearing, Tom, where, for example, one of our medical professionals said half their friends question what they do for a living based on the fraud articles. And that just kind of is heartbreaking, quite frankly, because he is so dedicated to quality patient care. And I was also aware of families who were not choosing hospice because they were afraid. They didn't want to participate in fraud. So the article really started with that concern and with the sense of responsibility to help people understand the difference. So one of my team members, Laurie Heyman, sent me the draft of a public education message because we feel strongly that our community needed two things at the same time: honesty about the problem and clarity about what ethical hospice care looks like. And this led to a broader collaboration with 4 other California-based nonprofit CEOs. And together we wrote the piece, Hospice Fraud is Real, but so is Ethical Hospice Care. And we think it's important that respected nonprofit leaders speak with one voice and say both things clearly. Fraud must be aggressively addressed, and at the same time, we cannot allow that fraud narrative to erode confidence in the compassionate, regulated, community-based hospices that families truly depend on and have been depending on for decades. So in other words, we wanted to move people from fear to informed choice.
That's great. And I know Karen and Viki, you both have also been really active in your states, helping tell the story of hospice and community-based care. Tell us a little bit about the positive messages you're trying to convey, especially when you're speaking to community leaders and policymakers, referral partners, or even the media.
I'll jump in. I think one of the things we try to impact or impart on our community is, again, the longevity. We've been here. Hospice has been part of the healthcare system. We've been serving families for over 40 years. Just the benefit and trying to dispel the myth a lot, kind of going back to where we were before the whole fraud issue started coming into play, of what hospice is, that it is not just for end of life. We hear that all the time. It's, I'm not quite ready to die yet, so I'm not going to be on hospice. And we try to dispel that myth of, no, hospice is for you long before you're ready to die. We're here to help have that quality of care, to help walk that last path with you. but it's a 6-month benefit. So we should really be thinking about what we can do for you for the next 6 months. We're the only system that embraces you from a full contingent of team members. We have the social worker, the chaplain, the aide, the nurse. We have a medical director who's there to talk to you about any symptoms. So we've really been trying to get back to what hospice is and kind of our roots of what we can do and how we provide that care in our community. And that seems to be resonating as far as, oh yeah, this is a good thing. This is a positive thing that I want to be a part of, instead of, oh, they're going to steal your Medicare number and, take your identity from you.
You're really taking such a thoughtful and proactive approach, Viki. Thank you for that. And how about you, Karen?
Same thing that Viki said, and Tim, our longevity in the community, we're coming up on 50 years. I think people see Nathan Adelson Hospice as the community hospice, so we remind them of that we've been here for a long time. But I depending on the audience, I really, I use the Bill Finn Uber story all the time.
Yes.
About his
That's
run-in with the Uber
Yep.
driver in Las Vegas at the NPHI meeting, and that really does get people's attention.
Well, now you have to share the story, Karen.
Hi, NPHI. My name is Zach, and I'm the co-founder and CEO of Brillium. And Brillium is the AI-powered compliance platform for agencies all around the country that helps you protect your revenue against survey risk by making sure that all of your patient visits are compliant across the board. You can find us at www.brillium.com.
Bill got into an Uber. I think he was going to Walgreens or something.
Yes.
Started talking to the driver about why he was in town, and the driver said, "Oh yeah, my wife opened up a hospice, and she made millions. She just gets a doctor to sign off on whatever she needs, and I'm thinking about opening up my own hospice." And then Bill pointed out that that's probably not the best way to run that business, and that was probably fraud and in some ways abuse. And so he thought maybe he could make some money by turning her in.
Yeah.
So I think I got most of it, but I tell it a little bit more eloquently than I did right now. But that certainly gets people's attention.
Yeah, absolutely.
Yeah, that was a funny situation, yet a very serious situation.
Right,
When Bill
right.
came back, he was a little horrified when he came back to the summit.
Well, such an example of what's going on out there.
Right. I mean, talk about a on the ground, like, true example of just someone in the community that has this perspective about money to be made in hospice.
As we've talked about hospice and the importance of it, we also recognize that it's not just a healthcare service, that it's really much more than that. How do you convey the bigger picture of what it is to distinguish ourselves? Because it's so different. Tim, how have you done that? And Viki and Karen jump in as well.
Well, the fact number one that hospice is interdisciplinary. It's not just doctors, it's not just nurses, but the social workers, the home health aides, who are really one of the most beloved elements of hospice care. We have the chaplains / spiritual support people, along with volunteers. So we have these whole teams that come in and support these patients. So again, it's not just about symptom management, it's about caring for the mind, body, and soul. And that oftentimes is really eye-opening, because in the healthcare system at large, nobody experiences that. So isn't it a shame we kind of have to wait till the end of life to experience that full spectrum? But that's why families are so grateful for hospice, because they get support too. It's not just the patient.
I think Tim's, spot on. I think getting ahead of that, you have a whole interdisciplinary team that comes to your home, right? What other, piece of healthcare does that right now? People are very grateful after they've had that hospice experience, but we want to make sure that they understand that, prior to signing on to hospice, they do have all of these wonderful people that will come to their home and provide care to them.
This is really a terrific conversation, and we can't thank the three of you enough for joining us today. I think it's a timely conversation and really helpful for our members. We'd like to close with a quick fill in the blank, if you will. So if you bear with us here and complete this sentence. The hospice story we should be telling more often is blank. And Karen, how about I call on you first? How would you fill in that blank?
Well, I would say, we're one of the most compassionate and cost-effective healthcare services available, right? Providing expert care, emotional support, not just for the patient, but for the family at a time when they need us the most.
Great. I love it. How about you, Vicky? The hospice story we should be telling more often is
So much more than just pain management. We hear that all the time. Well, I'm not in pain. I don't need your help. And I think the story we should be telling is, to Tim's point, it's so much more. We have this whole team. We wrap around you and we embrace you and we help you walk this last path. And I think that's our story. We've been doing it. We know how to do it. And we can help you both emotionally, spiritually, and of course, through pain. But we help your family members. And that's the bigger piece of what we offer is it's not just for the patient. It's for their whole family, their whole system that is involved with this last walk.
Yeah, I love that. I always say hospice is definitely what's right in healthcare. Definitely
Yes.
what's right. And how about you, Tim? The hospice story we should be telling more often is
That trust, quality, and local reputation matter, and families deserve providers who deliver compassionate care and are willing to be transparent about it.
So important. Yeah. I think as we have this discussion today, it's so enlightening and so helpful. And I think our viewers are going to really not only enjoy hearing all of the things that you're doing, but will get a lot of value at it to their programs as they go back and sort of think through how to address these issues in their communities. But I think one of the themes that I've heard is, going back to the basics here and describing what we do, who we are, how we do it. Remember, 45 years ago, 1982, we created the first comprehensive benefit that was all-inclusive, that was team-based, that was capitated in payment, and that required the use of a volunteer, that required that we do psychosocial, spiritual. And remember, it was not just the patient, but the patient and family. And I think that message has gotten lost. And I think maybe going back to the very core of what we're about and what we created is really important.
Yeah,
because there's no other benefit like it.
Yeah, I really love that, Tom. And weaving in the family members and everyone that's involved in that patient's care.
Yes. Yeah. Well, as we close, any parting comments or last comments from each of you? We're so grateful, as Carole said, to have this conversation.
I would just say to the members that are listening to the podcast, when we started first seeing this issue come up in Southern Nevada, I reached out to Carole at NPHI and said, I don't know what's happening, but, we need some help. And so if you see something that's going on in your, in your state, in your communities, NPHI is a really great resource. And thank you to both of you, Tom and Carole, for, your leadership and taking the lead and helping members figure out what the next steps are. And I know that Ethan and the policy team has been doing a lot of work around, state initiatives and, playbooks and, what's the first step to take? Because sometimes you just feel like, what is happening? I don't know what to do, right? I don't know how to address it. So, I would just say as a closing comment that, if you see something and you feel like you need some help, reach out to the leadership at NPHI because it was really helpful.
Well, thank you for recognizing that. And it does remind us that, not too long after that, we had Dr. Oz on the ground in Las Vegas. And I think Kim Brandt and others have taken this so seriously and recognize the potential impact of fraud and abuse to our benefit, which is really critically important. Vicky, any last comment?
Yeah, I think, though, I would echo a lot of what Karen said. I think forming together as a community, this is a storm, and we'll weather the storm. It's a part of, unfortunately, what we have to go through. But I think as, strong nonprofits in our nation, we need to stick together. We need to support each other, and we need to make sure that if you do need help, to any of our members out there, just reach out to any one of us. I have never found anybody in NPHI that hasn't been willing to help or been willing to just listen sometimes. So I think we just need to stick together and weather the storm.
Thank you.
Tim?
Well, what an honor to join the four of you. And Tom, I'm glad you went back to the beginning when there was no reimbursement for Medicare. for hospice care, and you were involved in that, and I got to meet Snowline's founder, Doug Tustin, last year, and how generous hearted were these people back in the days when they wanted to provide this care really for free. There was no reimbursement. So really, it's our duty to carry that forward. I love embracing the past to remind people of why hospice exists, and absolutely the strength of the NPHI collaborative is invaluable. I rely on other members all the time, and again, just thank you, and I'm really honored to be part of this conversation. So thank you.
Thank you, Tim. I was going to mention that another great resource is just calling one another. And so many members were seeing that happen. And it really is just a really powerful way to connect and have the opportunity to learn from others. So
it's an honor for us to be able to work for you and with you. And thank you for all you do in your communities. And we'll all stick together. And as you said, Viki, we'll weather this storm, and we'll continue on doing the right thing for our patients and families. Thank you.
Thank you, Tom and Carole.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
We'll be right back.
Hi, I'm Ernesto Lopez. I'm the CEO and founder of 1520 AI, an AI-first company and a part of SynPal Health Solutions. As a 2026 MPHI executive sponsor, we'd like to extend an introduction to our organization. We look forward to connecting with you in the next several months and sharing with you all the exciting products we have under development.
For more information, please visit 1520.ai or to connect with Ernesto direct. Send an email to elopez@1520.ai.
One thing we've been talking about throughout this episode is that not-for-profit, community-based providers have an incredible story to tell. The challenge isn't that the story doesn't exist, it's that sometimes we're so busy doing the work that we forget to talk about it.
Oh, I mean, it's so true because every day, right, our members are caring for patients and families and just solving those real-life challenges. And too often these stories just never leave the walls of the organization.
So we thought we'd spend a few minutes talking about how providers can share those stories more effectively. Well, joining us today is Brad Luna from the PR firm Luna and Eisenla. Brad has worked closely with NPHI on public relations, media outreach, helping elevate the voice of not-for-profit hospice and advanced illness care for our providers throughout the country. We're really pleased to have you with us today, Brad, and looking forward to our discussion. Why don't you give a little bit of background to our viewers, and then we'll get into questions about communication.
I'm the co-founder of Luna Eisenla. I'm based in Chicago, along with a few of our team members. We're an executive level communications firm. So all of the folks working on our team are working at sort of a senior level, from our AI growth strategist to our creative director. And, a lot of the folks that work on our team are seasoned through, some of the biggest fights and the biggest issues policy-wise of the day, from announcing the cure of rare diseases to, mobility and transportation and infrastructure to tax equity for small businesses. So we really help our clients tell their story and impact policies and change behaviors.
Well, we're thrilled to have you with us, Brad. Thank you so much for joining us. And, it's like an unveiling party with our members. So you haven't really met our members before, so they're going to be really interested to hear what you have to say. And you closely support Matt and the great work he does. And Matt just recently put on our member portal an op-ed and local media engagement guide. It looks like this for members who are looking in on us here. And I know that you were very instrumental in working with Matt on that. What's the biggest opportunity you see for provider organizations to tell their story more effectively?
Well, one of the things we tell our clients all the time is, first, if you want coverage, you have to show up. It's sort of like, if you're not on the field, then you're not in the game. So the first thing to do is really to show up. And what does that mean? So journalists, bloggers, new media writers, everybody works on a deadline in this field. So really, when those stories come down and they're having to put a story together, it's the people at the top of the pile oftentimes, the sources that they know, the people they're familiar with, that they're going to turn to put that story together. So if you're not at sort of the top of that pile or in the mix at all, then there's no way you're going to be able to get coverage. So the first thing we say is, just engage with reporters so you can become part of their Rolodex of sources. That's the first thing. And do it in a consistent way that keeps you in a drumbeat, sort of a top of mind when these stories do come down. The second thing is really look at your strongest characteristics of your organization. So every organization is going to be different. And there's no one size fits all, but I do think a good sort of rule is to look at what are the things that make you different? What are the things that make you unique in the storytelling? So let me give you a couple examples of that. One may be data. You may have information at your fingertips that's proprietary, that's about the people you serve, or the types of programs you're giving to your clients that are maybe different than other folks. So, maybe a unique data thing is what your organization has. Or it may be sort of programmatic stuff. Do you have more veterans that you're serving than others in the area? Is there a human interest part of this story that you can really get into? Are there parts of that story that you can tell how you're keeping people connected? Whatever that sort of programmatic thing is that sort of make you unique as an organization. So I would sort of suggest doing a top-down audit of your organization and look for those sort of nuggets of things that stick out that you probably know, and maybe do it every day so you don't think it's anything interesting, but it actually is very newsworthy. So make sure you know your strongest characteristics before you reach out.
It's really helpful.
Absolutely. Brad, a lot of a lot of leaders often think that media outreach means landing a story in the New York Times or the Washington Post, but I think that's really not where most local organizations should start. Give us your thoughts about that, and where should they start when they begin this process of outreach to local press organizations?
Well, the first thing, I think for folks to know is sort of, we always say media begets more media. Which begets more media, which begets more media. It's just a sort of this rolling ball of media exposure once you start. So the smallest, oftentimes reporters will do is they will, Google your organization. They'll be reading other sources locally. Even New York Times reporters who are, stringers that are based in Dallas, Texas, for instance, are going to be reading the local Dallas news. So the way you get sort of up the ladder in terms of types of media is to first start with the media that's in front of you and then work your way up. But on top of that, I think, a lot of folks, the audience that you're going for is the most important thing. What are you trying to impact? Who are you trying to reach? I always say to folks that, media is really just a currency at the end of the day. It should really reach back to your business goals or your organizational goals. What is it getting you? Because, media for the sake of media doesn't really buy you much. But if you're able to leverage that awareness, that communication in a way that helps you, reach the goals of your organization more effectively, that's really what you're after. And oftentimes for, members like yours, that is going to be more localized media to be able to help their growth strategies, help to reach audiences they want to reach, tell the stories they want to tell. So really look at, what are your goals, who are your audience, and then match the media outlet to that instead of the other way around.
What are the mistakes that you see?
I think one of the largest is, I don't think this is, quite frankly, I think where we do a good job of being an outside consultant, I don't think people understand the strength of the information that they have at their fingertips. Because you do it every day, you don't see it through a media lens. You see it through a delivery of service to client lens. You see it as a quality of care lens, but we look at it as a media lens. So really, you probably don't know that you have as powerful of information as you do. And one of the things is underselling that information to media. I think that's a major thing that folks do. The other one is, you always obviously got to be honest with media. You got to shoot straight with them. These are people with really high skeptical viewpoints of the world. Their job is to dig into things, to keep people honest and accountability. So, always make sure that when you're sourcing your information out, that it's done in a way that, you're not overly embellishing, that you're making sure that you have sourced information that you can reach back to if it's data or whatever, because they're going to want to see that. So before you start selling something, make sure that you have all the goods there.
We're pleased to say that we just reached 130 members 130 members strong. So we're really excited about that. And some of our members don't have relationships with the media, or they've never talked with the reporter before. So what tips do you have? How do you suggest they start building those relationships with reporters?
Well, I think the first thing to do before you ever outreach to a reporter is just spend some time reading the stories and seeing who's covering your issue. So look at the reporter. If somebody writes a story about, hospice care or healthcare quality, do some digging into that person. Some of the things I think about when I look at a story is, who are the sources that they have? How did this story come together? What's sort of the information that they're putting in the story? Are they using a lot of data? Are they using a lot of human interest stories? Is it more of a process story about legislation or regulation that's happening? How does that story sort of come together? And oftentimes when you find the reporter, you can get to a portfolio of their stories that they've written on that same news site and look at the other issues that are intersecting with this issue that your organization is going after. So for instance, if it's, hospice care, are they writing about, more senior issues broadly? Are they writing about mostly, social connection and isolation among seniors? Look at the ways that they're being impacted by the story that they're writing. That's what they're being assigned by their editor. So you want to sort of inform yourself and research way before you do outreach, and then spend some time looking at the portfolios of those reporters. And then the second thing is look for the opening. So media is such a news of the day. And, if you try to get a story written about hospice care when they've not written about hospice care in 6 weeks, it's going to be a much more difficult thing for them to pay attention to you than if they've just written a story on hospice care and then you reach out right after that. It's just, they're being assigned stories of the day. The third thing I would say is, we're in a world now where email is better than a call. Most reporters are on deadlines, they're working, they don't want to be interrupted with a call. The other thing too is we've had clients, I'm not kidding you, that we've reached out to a reporter. They've searched through their folders and their Rolodex of stuff and reached out to us for a client 2 years after the fact. So when you email, they put it into subfolders in their email and it stays there. And they may reach out to you a year or two later, but that way it's memorialized in a way that they can search it later on when a story gets assigned to them.
One of the challenges we face now, Brad, is so much of the stories being written is about fraud and abuse and the fraudulent activities that are going on, particularly in the West Coast. And I think that's distracting or creating challenges for our providers, our members, to shift the story to the quality care that they're delivering in their local community as opposed to that issue. Any words of advice as to how to shift that dialogue from the negative to what is going on in their local community, which is often a very extraordinarily important story?
Well, first of all, is we talk about don't feed the beast. So if you're not being asked about it, don't bring it up. There's no sort of reason to continue to fuel the fire. But if you are, address it in a way and then pivot off of that very quickly, and differentiate yourself from what's happening. So be able to talk to media, what's happening out there is, a bad thing. It should be looked into. We support that. But let me tell you what's happening here locally. We're set up very differently. So you want to find ways to sort of differentiate yourself from the providers that are going through this out in California, and look for ways to then dive into your issue locally, and don't dwell on it. You can quickly sort of move off of that issue. But if they don't bring it up, then don't feed the beast.
So if every provider listening could do one thing this week to become a better storyteller for their organization, what would you tell them to do?
Well, first of all, read the NPHI guide that Matt sent out, because I think it has a lot of good information in there.
Yes, which we have right here.
Nice plug for Matt there. Very nice. Here it is.
Yeah. Here it is.
Yes, exactly. But the second thing I think I would do is, really sort of catalog and spend some time with maybe staff members that aren't your communications folks. I always like to sit down with the program lead or the person on the front lines who has the story. And, I think those are the people that are really there, close to the story that's happening on the ground. So spend some time and go through your organization, look for folks that may not be in the conference rooms, coming up with communication strategy or business strategy, but are really on the front lines with clients. That can bring some good stories back, because those human interest stories from clients really illuminate the overall message of what you're trying to communicate to folks.
Right.
We're going to take a quick break and we'll be right back.
Does your biller want to see if a claim was accepted? Or maybe which patients need urgent attention? Just ask. Introducing Ask Access, our smart assistant that puts real-time operational and clinical insights right at your fingertips. Whether you're delivering care at the bedside or running day-to-day operations, Access Intelligence keeps you ahead, compliant, and connected. This is the future of care at home. Effortless, built with heart. Access Intelligence.
Well, just one fun question to kind of close us out. You've spent your career helping organizations tell their stories and connect with audiences. What do you enjoy most about the work that you're doing?
I'm grateful that we've been able to be in some of the biggest issues of the day and help shape those discussions. I mean, as the country ages, the issue with MPHI and quality of care for end of life and hospice is only going to become a bigger issue. I mean, these are important issues that impact, everybody's life. I was just telling you all before that my parents are here, I'm at midlife, and, these are issues that I think about personally. So it's always been such a interesting thing for me, whether it be, I remember we had our first transportation client, and I thought, well, this is going to be so boring. I'm not interested in transportation at all. It was fascinating. It was fascinating to think about how mobility affects your ability to get healthcare. Mobility affects if you can get home to your kids or not after school, to spend time with them, quality of life. So all of these issues, aren't, to me, don't live in a bubble. They really sort of, I can see how they impact my life, my family's life, my friend's life. And I think that's been the funnest part of the work that we do.
That just reminded me, Carole, of Bob Dole. Who, and you've heard me say this before many, many times, but I don't think, Brad, you have. But I worked extensively with Senator Dole, Bob Dole, when we were creating the Medicare hospice benefit. And he used to say, Tom, we've got to get this right because one day we're going to need it for ourselves and our families.
I have heard you say that, and it's so true.
You just said that.
Yeah.
I mean, we look at our own families and the impact on our lives, and I think these are really important ways to connect it to ourselves.
Very much so.
Absolutely.
Well, thank you, Brad, for all the good work you do and your firm for us. And we really appreciate it. And we look forward to continuing to work together and your leadership in helping us get the story told in a way that's meaningful and important.
Well, it's an important story to tell. I'm glad that we're here.
Yeah, great to be with you today, Brad. And thanks to everyone for listening. And just remember that some of the most powerful stories in healthcare are happening every day right in your organization. So don't be afraid to tell them. And we'll be right back.
For more than 30 years, One Point Patient Care has been exclusively dedicated to serving the unique needs of hospice patients. We are accountable to you and your patients for the entire continuum of hospice pharmacy service and support. At a time when hospice providers everywhere are searching for reliable pharmacy support that truly understands their unique needs, One Point is here. Our extensive inventory of hospice medications, including custom compounds and infusions, ensures we always have what your patients need in stock. For more than 3 decades, we have stood beside you, fully aligned with your mission, because your mission is ours too.
We certainly had a great discussion today, didn't we? With particularly the conversation with Tim, Karen, and Viki.
Yeah.
Their insights were just tremendous. The work they're doing at their local communities around this issue were really important to hear about, and were enlightening about strategy and approach.
I am in awe of their unwavering commitment in their communities and making sure that we lead with quality.
Absolutely. And that certainly is what distinguishes us and our providers from those who are not providing those kind of quality care models that are so important.
I mean, we have such an important story to tell, all of our members. And I think Brad did a great job giving us some great advice on tools and tips on how to get that message across in local communities.
It's so important to convey this at the local level, and I think their advice was extraordinarily helpful.
Yeah. Great episode today.
Really good.
Yeah. Thank you to everyone listening. While headlines may come and go, the work happening in communities across the country every day tells such a much bigger, larger, and more important story.
Indeed.
We look forward to seeing you next time on Inside View by MPHI.
Welcome to Dragonfly Health. I'm Paul DeCosmo, co-founder and CEO. Dragonfly Health provides medical equipment and pharmacy care to patients all across the United States. We serve hospice, PACE, skilled nursing facilities, and the hospital at home market. Dragonfly Health's purpose is to do whatever it takes to transform the care at home experience for our patients, customers, and network providers.
A big thank you to all our partners who make this podcast possible. Access, Brellium, Dragonfly Health, One Point Patient Care, SimPal Solutions, NetSmart, OSHN, ArcHouse, Glossary Health Solutions, and Symmetry.
If you've enjoyed today's podcast, stay connected with us and our work on LinkedIn and Facebook at NPHI Health, or just search NPHI.